Hello, my name is May Kwong, the Executive Director at the Center for Connected Health Policy. Welcome to our Telehealth 201 Medicaid Telehealth Policy instructional video. These are a series of videos where we will be providing you with a little bit more in-depth view on how Medicaid Telehealth Policy works. Few disclaimers before we get started. Please know that any information provided in today's talk is not to be regarded as legal advice. It is strictly for informational purposes. Always consult with legal counsel if you are interested in a formal legal opinion. And know if I happen to mention a company or show some type of product that neither I nor CCHP has any relevant financial interest, arrangement, or affiliation with such an organization. So first off, we're going to be talking about Medicaid and telehealth policy. And Medicaid telehealth policy is really about coverage and reimbursement. And those policies usually have four elements upon which they touch upon, four different issues. And those issues are the service that's covered, the location of the patient at the time the telehealth interaction takes place, the modality that's used, and the provider who's providing the services. So what you'll see with a lot of Medicaid policy around telehealth is usually something touching upon one or more of these specific issues. So for example, you may have a Medicaid program that says our telehealth policy is to reimburse for behavioral mental health services, the services covered, when the patient is located in a clinic or a hospital or a doctor's office, location of the patient at the time of the service, and the service is being provided over live video, the modality that's used, and when the provider providing the service is a psychiatrist or a licensed social worker. So the eligible provider who's able to provide that service and be reimbursed by the Medicaid program. And the way Medicaid programs approach this and what their telehealth policies and what to cover and who to reimburse and all the other issues and parameters on which their policies are built upon really vary from state to state. So for those who aren't familiar, Medicaid provides health coverage for certain populations such as low-income adults, pregnant women, elderly, and people with disabilities. While it's administered by the states, there are federal requirements that the Medicaid programs need to follow. And also the funding for the programs is a mixture of both state and federal funds. Now, for their telehealth policies, Medicaid programs and the states actually have quite a bit of leeway as far as how they want to shape their policies and what they'll cover. So Medicaid reimbursement for telehealth delivered services really just must satisfy federal requirements of efficiency, economy, and quality of care. States also do not need to submit a state plan amendment if they decide to cover services via telehealth, as long as they're doing it in the same way as they would have had the services been provided in person. So for more information, the CMS had issued a toolkit for states on Medicaid and the CHIP program and how they can look at their telehealth policies. And also there's the Medicaid.gov page on telehealth and state Medicaid. They are hyperlinked in the slide and the slides are made available. So you can download it and go to those two sources if you like. Now, right now for Medicaid reimbursement, keep in mind, this is information that's being provided to you September and October of 2021. So if you're looking at this video a couple months later, some of these numbers may shift, but right now on the date this video is being recorded, on the fee-for-service side of things, Medicaid reimbursement for telehealth, every Medicaid program is doing something around live video. So these are their permanent policies. Again, as this is being recorded, we are still in the COVID-19 pandemic. So there are temporary telehealth policies in place for some states, but on permanent policies, every state reimburses for some live video or something related to live video in their Medicaid program. Store and forward and remote patient monitoring, not as many states are doing that reimbursement as they are with like live video, but there is a significant number. Over half the states are reimbursing for some type of remote patient monitoring, and almost half the states are reimbursing for some type of store and forward. Audio only is something that has really taken hold over the last 18 months due to the COVID-19 pandemic. Before the pandemic, if you were to talk about telephone or audio only and reimbursement for it in Medicaid programs, most states, practically all of them, would have said, no, we don't reimburse for that because we don't consider that part of telehealth. There were a couple of states that were doing some reimbursements for it. Arizona was an example, but they were doing very sort of focused reimbursement or for specific things like chronic care management or for care management services. But now that we're seeing 18 months into the pandemic, some states adopting more permanent policies regarding audio only. And right now we have about 18 states that have some sort of permanent policy touching upon audio only. Again, this could be a very narrow type of policy. Perhaps they are only allowing audio only for some types of services, such as behavioral or mental health services. But it was something that we were not seeing before COVID-19 hit. Those brown states there are states that are allowing audio only, but they're allowing it only really under those virtual check-in types of codes. So they're not necessarily allowing them to replace an in-person service such as an office consultation there. And also there may be some states that you are looking at this map and you're saying, but I thought they passed legislation in order to require audio only to be covered in Medicaid. We only count the states that have actually implemented that policy, where there's an actual written Medicaid policy in place that we can point to that says this is what we're doing around audio only. So even though a state may have passed a piece of legislation saying that their Medicaid program will reimburse for audio only services, until the Medicaid program has implemented, CCHP does not count that, simply because we're not quite sure how they're administering the program or like implementing the program. So that's your quick overview about Medicaid and telehealth policy. If you want to find out a little bit more about the individual state Medicaid policies, please visit the CCHP website and look for our telehealth policy finder. We do track all the states in the United States and the District of Columbia, and we do track their Medicaid policies as well. So you can dive a little bit deeper on CCHP's website. So thank you very much for listening to this quick sort of tutorial on Medicaid and telehealth policy. Have a great day.